evening, everyone, and welcome to tonight's presentation. My name is Dr. Brittany Bergeron, and I'm going to be speaking with you about the integration of bioactive materials to grow your practice. So a little bit about myself. I'm a graduate of the College of the Holy Cross in Worcester, Massachusetts, and I completed my dental school training at the University of Maryland School of Dentistry. Very proud to say that I'm one of 3 Maryland trained dentists in my family. Both my brother and I followed the footsteps of our father. I'm a private practitioner. I own my own office in Towson, Maryland, which is just north of Baltimore City. And I've owned this office since April of 2019. So I practice by myself there a few days a week, and then I work in another office as an associate part-time. I was given this opportunity by my involvement with the American Association of Women Dentists, for whom I currently serve as the immediate past president and the director of corporate relations. Being involved with the AWD has let me give back to my community through the Smiles for Success program, which provides free dental care to women who are in job training programs, trying to transition from being incarcerated or victims of abuse back into the workforce. So I help to restore their smiles so that they can gain the confidence they need for interviews, etc. So the disclosure for this evening's event, the lecture is being sponsored by the Pulp Dent Corporation. They provided the financial support. However, the opinions that are being presented in this lecture do not reflect those of the Pulp Dent Corporation. Our learning objectives for this evening are as follows. At the conclusion of the program, the participants should be able to understand the role that bioactive materials play in restorative dentistry. They should understand the technique for placement and indication for use of bioactive materials. And they should have tools and talking points to educate their patients on the benefits of using bioactive materials. So let's dive right in. What exactly are bioactive materials? This is a term that you've all probably heard at one point or another. And I thought it was really interesting and wanted to share that bioactive materials were first developed in the late 60s during the Vietnam War. Dr. Larry Hench was looking for a material that would better treat soldiers returning from war that had a variety of different injuries. So he coined bioactive materials as those that elicit a specific biological response at the interface of a material, which results in the formation of a bond between the tissues and the material. So how does this apply to dentistry? Dental bioactive materials were created to imitate nature in the oral cavity. So some key traits of bioactive materials would be that they stimulate appetite formation, and that appetite formation helps to seal the margins against micro leakage, fill in any gaps that are present, and ultimately help to rebuild teeth. Bioactive dental materials are water-based, and so they participate in an ion exchange that would normally occur between the saliva and the tooth. They can help to be a part of and facilitate this exchange. So there are a few different categories of bioactive materials, and in looking at the examples on the screen, you've probably encountered or used a lot of these in your practice. So there are materials that remineralize. That would be your glass ionomers, for example, the Riva Self-Cure material, glass ionomer derivatives, so Activa Bioactive class of materials, geomers, so the Beautifil 2 by Shofu. And then there's also materials that deposit hydroxyapatite and remineralize. So that would be your calcium aluminates, so your ceramure cements. And then those that have the properties of the first two categories, but also regenerate the pulp. And that's your calcium silicates. So your MTA-based materials, products that are more commonly seen in endo for perforations and things like that. So for the purpose of today's lecture, we're going to be focusing on the Activa Bioactive group of materials. There's actually 4 different products in this product line. I use most of them in my office. So we're talking about the Activa Bioactive cement, the basin liner, the kids material, and also the restorative. For the sake of this evening, we're going to focus on the restorative. I would say that's the majority of what I use in my office. And I think you guys will be really interested in the material once we get started here. So I'm going to take you through some of the physical and the bioactive properties of the material. Like I said, I'm a clinical dentist. I'm not involved in research. And so when I was going through the research and sort of doing my homework here, I was really trying to present this from the perspective of the clinician. What do you need to know if you're going to choose to use this in your office or choose to recommend the material to your patients? So we're not going to be going super in depth of the nitty gritty of the research, but really just presenting more of the results so that you can make a decision on your own. Tonight, we're going to be evaluating the strength, the wear, the toughness, the water absorption, the water solubility, and the radiopacity of the Activa BioActive restorative material. So first, let's look at the strength of the material. If it's been a while, for those of you who have taken dental biomaterials like me, you might need a little review of your terminology. So we're evaluating both the compressive strength, which is the resistance of a material to breaking under compression, and the tensile strength, which is the resistance of material to breaking under tension. And you can look at these two graphs. We have compressive on the left and tensile on the right. And you can see that Activa is being compared to Filtek Supreme Ultra, which is a very popular composite on the market, and also to Keitech Nano and Fuji 9. And what you're noticing in these graphs, hopefully, is that the Activa, although it's not a traditional composite, is showing to be just as strong as traditional composites are, and stronger than the resin-modified glass ionomers and glass ionomers. So when we're thinking about where we might use this restorative material, certainly with the strength that it's exhibiting, that of a regular composite, it would make a great material to be used in posterior restorations. In looking at the wear, or the way these various materials wear, we're looking at Activa, Tetric Evo Flow, Beautiful Flow Plus, again, the Keitech, Vitrobond, and Fuji Triage. And these materials were all tested in 10,000 cycles. So if you're doing 10,000 cycles with toothpaste, which is what they did, we tested with both abrasive and non-abrasive toothpaste, that translates to roughly 13 years of brushing your teeth if you're brushing twice a day. So these tests were really intended to show longevity of wear on these restorative materials. So on the left side of the bar graph, we have the non-abrasive toothpaste, and then on the right side, we have the abrasive. And you can see that Activa performed incredibly well in comparison to the other materials. So we showed the least amount of wear for the non-abrasive and the least amount of wear for the abrasive toothpaste. So again, when we're considering restorative materials in a high activity part of the mouth, this is looking like it would be really promising. So the next area to evaluate would be the toughness of the material. So toughness is the ability of a material to absorb stress and to dissipate the force so that it resists fracture when a load is applied. So if you're looking at the graphic that's on the top left area, we're putting pressure in the middle of the material and looking to see, is it going to flex or is it going to break? So the toughness is measured by the deflection at break using a 3-point bend test. And the deflection at break of Activa, which is shown in the graph on the lower left, is showing that it's actually 2 to 3 times greater than traditional composite. Again, we're comparing it to Filtek Supreme Ultra here. And it's 5 to 10 times greater than the glass ionomers or the resin-modified glass ionomers. And this is largely due to the composition of Activa. It's composed partially of a rubberized resin material, and that helps to prevent fracture and chipping better than these other materials that it's being tested against. So water absorption is kind of an interesting thing to think about when you're talking about any sort of resin material. You learn in school that water is a bad thing and you don't want any water in your preps. You want everything to be really dry. But when we're talking about bioactive materials, there's actually some level of water absorption that's necessary for the ion exchange to occur. So when this material was designed, it was designed to have a low level of water absorption so that it could be bioactive, but not so much water absorption that it would compromise the physical properties of the material. So again, we're comparing Activa to the Filtek, the Fuji, Keitech, the same that we've been looking at. And you can see that over time, the Activa is really on the lower end of the water absorption, again, closer to a traditional composite. So water solubility is another important property for the reason that the more water soluble a material is, the less durable it is over time. It's probably not surprising, as you guys are looking at this graph, that the materials that exhibited higher strength, the Activa and the Filtek in the previous studies, are the ones that have the lowest water solubility, whereas the Keitech, the Fuji, those that were showing less strength over time, have a higher water solubility. So those things are directly correlated. Radiopacity, I think, is a really important thing to know about your material. I personally like to have the ability to check my work. When patients come in for their X-ray recalls during their periodic exams, I like to be able to see the fillings that I've done on the radiographs. And with Activa, you will be able to do that. So what this image is showing you is a gradient of various thicknesses of aluminum. And you can see that Activa is equivalent to about 1.5 millimeters of aluminum. So it will appear to be radiopaque on your radiograph. So switching from the physical properties, we're going to look at the bioactive properties of the material. And for that category, we're looking at the ability for apatite formation, fluoride release and recharge, phosphate release, the amount of microleakage that occurs, and then the amount of bacterial microleakage that occurs. So before we get into these specifics, I think it's important to just sort of touch on why Activa is able to exhibit these properties to make it bioactive. And that is due to the reactive ionic matrix that it's composed of. So the reactive ionic matrix resin is moisture friendly, so we can have that ion exchange that we've discussed. And the way this occurs is that if you can see on the graphic on the bottom right, hydrogen ions break away from the phosphate and they are then able to bond to the calcium in the tooth. So we're creating a direct bond, and this is what's responsible for forming the resin hydroxyapatite complex that's responsible for the decreased microleakage. Unique properties of this ionic resin are the things that we've said we're going to discuss. It releases phosphate, there's an intimate adaptation to tooth structure, there's increased marginal integrity, the release and recharge of fluoride, and a strong seal against bacterial leakage. So when evaluating the apatite formation, this study was done using scanning electron microscope evaluation and also energy dispersive X-ray spectroscopy. Say that 5 times fast. So when looking at the results of this, what you're seeing on this photo is the top layer is Activa bioactive restorative material, this layer here, and then this is the dentin of the tooth. And you can see the mineral tags that are forming where the apatite or the dentin is bonding to the restorative material. This gap was created when the sample was fractured so that the analysis could be done, but the gap wouldn't typically be there. So I think this is really interesting to show that we can actually see the formation happening and prove that this is occurring. And it's again this apatite formation that's responsible for decreased sensitivity, less microleakage, lower secondary caries rate, and also a lower failure rate of the materials. So the fluoride release and recharge is probably one of my favorite properties of this material. This study shows Activa against Keetac Nano and Triage materials, and it looks at the fluoride release and recharge at various hour increments and also at 1, 2, and 3 weeks. We know that all of these materials release and recharge fluoride, but Activa definitely excels as far as the amount that's released and recharged. So in every instance from the starting point on, you can see that it's exhibiting the highest fluoride potential. It's recharging and releasing the most. So when we're looking at a material that's going to help to keep our patients' teeth healthy over time as they're using fluoride products, as they're getting their fluoride treatments, this is definitely one of those materials. All right, so similar to the fluoride release, there's also a phosphate release that occurs from the Activa restorative material. So this material has been coined as a smart material, which I think is actually a really interesting concept, right? We love smart things, smartphones, smart cars. We're a society of smart. So the way the Activa works with the phosphate release is that at lower pHs in a more acidic environment, the material is going to release more phosphate. Okay. And then when the pH is higher, is more neutral, the phosphate is going to be either in the pellicle layer or in the saliva, and it'll be free to interact with fluoride and calcium and other ions that exist in the mouth. So in a sense, the material is helping to balance out the acidity level, the pH in the mouth, which, as we know, if we can maintain a more neutral pH, we're at lower risk for caries and other issues. All right, so looking at microleakage, this is a really interesting study. We're comparing Activa to what, in my opinion, would be probably 3 of the larger composites on the market. So we're looking at versus Tetric Evo Ceram, Sonic Fill, and Filtex Supreme Ultra. So when we look at this study, I think it's really important to note that the composites are being tested with a bonding agent. The bonding agent was Scotch Bond Universal, which again, I think that's a pretty common bond. There's a lot of practitioners that use it. But the Activa was actually tested without any bonding agent because the adhesion of the material to the tooth is that good. So you can see that it performed exactly the same as the Tetric and the Sonic materials, and it actually outperformed the Filtec as far as the amount of micro leakage that occurred. So it's kind of an interesting way to think about it. We're so used to bonding all the time, but with this material, we're getting just as good of a seal, if not better than some materials, without using a bonding agent. So it's probably not surprising after the last slide that we're seeing less bacterial micro leakage with the Activa material. So this study compared it against Vitrabond light cure material, and you can see that at 20 days, there was no bacterial leakage from either material. At 40 days, the Activa was still not exhibiting any bacterial micro leakage, whereas the Vitrabond was. And then at 60 days, we start to see some bacterial leakage, but still excelling over the other material. So I think as a clinician, these are all important things to have a general knowledge of and to consider when you're choosing material to use for your patients. So just some other kind of, I don't want to say random facts, but other information about the material that you might not know. And occasionally we get this question in my office wanting to know if night guards and the resins we're using are BPA free. So I'm not sure if any of you have experienced that, but the Activa line of products are BPA free. The material comes as a two-paste auto mix system, and I'll show you a photo of that on the next slide. And it can be set by 3 different mechanisms. And I find this to be really convenient because depending on the situation you're in, you might use, 1 or 2 of these mechanisms on the same patient. So the material can be set through light cure technology in up to 4 millimeter increments. And then it can be self-cured through a glass ionomer reaction that occurs and also the resin chemistry. So the self-cure set time is 3 minutes. The material is available in shades A1, 2, 3, and 3.5, as you can see on your screen. And I think something that's important to note for those of you that have used universal materials that can be cured in deeper increments, a lot of times when you're working in the proximal box of a class 2 or 3 restoration, you can get almost a translucent appearance of that material. The universal composites are not always very aesthetic. And so in wanting to cure in a deeper layer, you sometimes compromise some of the final result as far as the shade or the color quality. When using this material, that's really not the case. You can cure up to 4 millimeters, but certainly, placing even more material than that at the same time, you're still getting a really strong color. So in my office, I use primarily the A1 and 2 shades, and I find them to be a really good color match. So here's an example on your screen of how the material what the appearance is. It's a 1-to-1 dual mix cartridge, like I said, and it comes in this dispensing gun that's more similar to an impression material. I actually really like the delivery system of this for a few reasons. One is I find that when I'm at the end of a conventional composite cartridge that's in a gun, you can have a lot of fatigue of your hand when you're trying to squeeze out the last little bit of material. Whereas with this, it has that, I guess I call it kind of a ratchet that it continues to click. So your hand fatigues much less frequently. Because of the plunger at the end, you can also see exactly how much material is left. And I think that's really helpful because it's always frustrating. And I'm sure we've all been in this situation where you're placing a composite and your assistant says, here's a new one, doc, and you go to squeeze it and there's nothing in there, or you get the very last little bit that's dried up. So with this, you can look immediately and know how much material you're working with and whether or not you need to pull out more. So let's talk about the steps of how you're going to place the Activa BioActive Restorative. And you all probably know this, but we're going to run through it just as a review. You're going to prepare your tooth surface for the restoration, remove any failed material, decay, etc. You're going to selectively etch your enamel surfaces. And then if you're bonding, you're going to use your bond of choice, place your Activa material, either light or self-cure the restoration, and then you're going to finish and polish and check your occlusion. So let's talk about the bonding situation. The literature that I presented to you shows that you don't bond and you get a good result. So how can we still use bond and get the apatite formation, the mineral tags that we're looking for that's responsible for the great seal of material? And I think that this is such a great question, and it was one of the first questions I had when I started using Activa. We know that a perfect bond, perfect hydrophobic bond, doesn't exist, right? There's always some level of permeability of the material. And so if we're thinking about it that way, or we're remembering that, we know that the ion exchange between the Activa and the dentin would take place through that bond layer because it is a semi-permeable layer. So in theory, we're bonding the Activa through your bonding agent and into the dentin. So really, we should end up with an extra strong adhesion or extra strong seal between those three materials. And here's just a graphic to show that. You can see the Activa material here that's coming out of the cannula tip, the dentinal tubules here. The ions are indicated by these orange sort of dots, and then the bond layer in the blue. So everything is taking place through this semi-permeable layer. So a consideration when you're using this material is the type of matrix that you're selecting. I'm sure there's plenty of people who are using a traditional Tafelmeier. We have those in my office and use them in certain situations. And then there's the sectional matrix. So this is an example of the Triodent ring by Ultradent, but there's a bunch of different brands on the market that are great. I know Garrison has one. There's a few others that I've used, and I like all of them. It's important to keep in mind when selecting a matrix and when using this material that it is a flowable material, okay? It comes out of a cannula tip, and you're able to, you'll notice it's like I said, really flowable. So when you're looking at making a good contact, you wanna make sure that you're either using a sectional matrix, which is really gonna, the strength of the ring, push the teeth apart, or that if you're using a conventional Tafelmeier, you want to make sure that you really wedge the teeth, because there's nothing more frustrating than finishing a quadrant of dentistry and taking out your matrices to realize that they were very easy to remove, or you go to floss and the floss falls through. So I would say that's probably the biggest thing that I've learned in using this material is matrix selection and how important that is. So we're going to walk through just a couple of case examples so that you can see what the material looks like when it's placed. We'll go relatively quickly through these because I know you all are aware of how to prep teeth and do the restorative part of the procedure. So this patient presented to my office. She had a mesial marginal ridge fracture of number 19. So we prepared her tooth for an MO composite. We're going to, again, etch the tooth. And then I did use a bond in this case. So I really like the Viva pen. I'm not sure how many of you out there are familiar with it, but I think it's great for a few reasons. One is that it has this gauge here at the base of it, so you can actually see how much material is left. It's dispensed through this green button that's here on the handle, and it comes with a tip that has a little micro brush on the end. So in using this system, you can really control the amount of adhesive that you're placing versus conventionally, you put a drop in the well and try to take just a small amount up onto your micro brush, and sometimes that works well, sometimes it doesn't. What I found is that a lot of bond tends to be wasted in offices, and it's probably the most expensive material that we use. So I really like the Viva pen. For those of you that aren't familiar with it, you might consider giving it a try. We're then going to place our Activa material. I use A1 primarily in my office, so that's what we're placing here. You can see there's a mixing tip that has the cannula end, and the cannula is a 20 gauge opening for those of you that are curious sort of how wide that space is. And here's our final restoration. So you can see start to finish our number 19 MO. So we'll do one more. This is number 14 OL. Again, we're going to excavate the decay. We're going to etch the tooth surface, apply your adhesive if you're using adhesive, and then fill with your Activa shade of choice for your final restoration. So let's talk a little bit about how this material can help to grow or to enhance your practice, okay? How can we increase patients, increase revenue? And I would break this up into two different categories. So I would say that there's the patient component of this, right? How patient education matters and how the patient perception of their treatment matters. And then there's what we'll call the office component, how it's going to affect your scheduling and your overhead, how it's going to affect your team's quality of work. So I'm curious if you guys can use the chat feature here, maybe just send a message to everyone. I'd like to know how many of you are talking to patients about the materials you're using in their mouth. And if you are talking to them, what does that conversation look like? And you can be brief. I'd like to just kind of get a feel for what people are using. And maybe you're not the one having this conversation. Maybe it's your assistant or your hygienist that's talking to the team or talking to your patients. All right, doesn't look like anybody wants to participate. That's okay. I'm going to walk through with you how this conversation occurs in my office and maybe some things to keep in mind when you are having this conversation with your patients. So these are just kind of some key talking points. By no means is this a complete list, but it's just an easy way for you to get started. So you always want to describe the material you're using. What does it mean for the patient? Most patients want to know, am I getting a metal filling or a tooth-colored filling? And that's about the extent of their knowledge, okay? It's up to us as providers to explain to the patient that not all materials are created equally. Now, we want to keep it simple. They don't need to know about the compressive and the tensile strength and our vast knowledge of the materials we're using, but it's important to let them know the reason you're choosing the materials that you are. And maybe that's the difference of why they choose to come to your office versus another office that's using the exact same material. So some things you might talk about are the bond strength, the aesthetics, the set time, the difference in postoperative sensitivity, and maybe even on some level, the ion exchange that is occurring. So I have created a couple videos. These were done with my office manager. So we tried to go through some of the questions that patients typically ask us around the time that they're having the procedure done. So I'm gonna play the first video. This is the pre-treatment conversation. This would be done likely at their hygiene visit or at their new patient visit when we're diagnosing the decay. And then we'll talk about the conversation with the post-treatment visit.
All right, Jennifer, so we've done your exam. I've taken a look at your x-rays that were updated today, and there are some areas where you're going to need treatment. You have 2 fillings on each side that we're going to need to take care of. Some of them are replacing your older fillings, and some of them are areas of new cavities or new decay.
Okay.
Do you have any questions for me?
They look at the old big silver things that they put in my mouth the last time.
No, not here in this office. So at one point the metal fillings were the high standard of care. Now we have better materials. So we don't do any metal dentistry here. We're going to use a bonded filling. So it's a white or a tooth colored filling, so that they'll be a little bit less obvious.
Okay. So you put the silver ones in because he said those white ones don't last as long. You have to have them drilled out every 3 years. Do we have to do this again in a few years?
Not unless there's a new cavity. So there's a few benefits to the materials that we use. I'm pretty selective in the materials that we choose to use on patients, and we use them for a few reasons. So the material that we're going to use in your mouth has some really beneficial properties. So one is that it releases fluoride. Fluoride helps to keep your tooth healthy, and it helps to prevent future cavities. As you know, we do the paint on fluoride on your teeth, and we recommend you use that fluoride at home. This material is going to be similar in the sense it's going to keep your tooth healthy. So sometimes when people quote time frames that fillings have to be replaced, that's based on the literature, but you know, there's no set amount of time that things are just taken out and redone. So you're very good about coming in for your cleanings and your evaluations, and as we go through, you know, we'll monitor everything. But that's one of the really big benefits, and the reasons we like to use this material is it's long lasting, it's really strong, but it also has that fluoride property.
Okay. Am I going to be really sore after this is done?
So you can always have a little discomfort after having dental work done, but another benefit of this material, the reason I love it, is it does really decrease sensitivity because of that fluoride release. It's intended to bond to your tooth, which increases well, I guess the bond of the material to your tooth, but it makes it so that there's no leakage, which can cause sensitivity and it can cause new cavities. So because we're able to cure the top layer of this material and the bottom sets, we keep our light away from the nerve of your tooth, which generates heat and can cause some sensitivity. So in my experience, now that we are using this material here in our office, our patients have a lot less generalized sensitivity after the treatment.
All right. Okay. Well, thank you.
All right, no worries. We'll see you back soon to get those taken care of, okay?
Okay, so when I watch this video, it's so funny. People always tell me that I talk fast, and I realize exactly how fast I talk. So hopefully I'm not going that quickly on this lecture. There's a couple of things to point out here. One is I do have the conversation with the patient about the material having fluoride in it. And every now and then we have a patient who says, I don't want fluoride, I don't like it, I'm not putting that chemical in my body, and they are really against using any sort of fluoride products, in which case you use a different material. Okay, I like using Activa. I use it for a lot of my restorative situations, but you always have to have something else on hand. So I think it's important to let people know about the fluoride property, because there are, some patients out there that really don't want to use it. I mentioned in this video about the light when speaking to the patient. So like I showed earlier, I use the Velo light by Ultradent, and it does have a 3-second cure feature. So that means the light generates a lot of heat, which in some situations, if you're working far away from the nerve, that's great. Other times you probably don't want to use it so close to the nerve. So that is something that we discuss with patients and that I'll talk a little bit more about.
All right, Jen.
Okay, so as far as the post-treatment conversation, we'll play this video and then we'll move on.
Okay, Jen, so sitting you up, we're all finished for today. Okay.
You're finished?
We're finished.
I thought we were taking a break for the next round.
No, so we were able to take care of all the cavities that you had on your right-hand side today.
Okay.
Or one of the reasons we like this material that we were using that we talked about at your last visit is because we can set it both with our light, and then it also sets on its own. So it lets us work a little quicker. Hopefully you'll have less sensitivity of your jaw. You haven't had to be open as wide or as long today as we were working. And that's definitely something that people are usually pretty pleased with. So just to review, you can always have a little sensitivity after having a filling done, but the material that we use is really intended to decrease the sensitivity that you have overall. So if you're used to having a lot of hot and cold sensitivity after procedures, you should really see a lot less of that after today's visit. Certainly let us know if you have any questions, but I expect you're going to feel pretty comfortable.
All right.
Remember, the material is going to release fluoride, okay? So it's going to help to keep your tooth healthy from the inside out, but certainly any additional fluoride products that you're using at home are beneficial to your mouth overall, and not only in these areas that we just worked today.
Okay.
Okay?
Right.
If you have any questions or concerns, let us know, and we'll see you next time to take care of the other side.
Oh, great.
Okay?
All right, thanks.
All right, it was good to see you.
Okay, so we had Jen say this part about you're done already, because that's such a constant comment that we get. When you're working in quadrants and you're able to, fill a preparation with material entirely and set the top layer, either to move directly into the adjustment part of the procedure or to let the patient close and take a break, they really notice the difference as far as either their comfort or the time that it took. So it's not uncommon when I finish a procedure, the patients will say, that was it? That was really fast. And that's always a little bit of a feel good for us. But, I include that because it's definitely something that if you start using this, you'll notice your patient's feedback there. So in looking at the patient perception, I've sort of listed here some responses that I've seen, or kind of common responses from patients that I treat. So the first thing I would say is patients are incredibly appreciative. They're appreciative of the time that you take to explain the material to them. And they're also appreciative that you're using a material that helps to keep their tooth healthy. When you say to a patient, this material has fluoride in it, and they always think of fluoride as keeping your tooth healthy, we don't want cavities, we use fluoride, they're thinking, oh, my dentist wants me to be healthy. I usually joke with people to say, contrary to popular belief, we don't want to cause you pain and we don't want you to have cavities. And, patients kind of laugh, but they also look at you like, yeah, right, doc. So patients are really appreciative to know that you're using a material that is good for them and that will give them a good outcome. With knowledge comes power. Patients feel empowered by having the information that you're providing them in your educational talk about the properties of the material, about how it's going to make them feel, and how it's going to last long term. I think in this day and age, we're all battling Dr. Google, right? Patients have endless amounts of information available to them on the internet. Some of it's true, some of it's not. And so a lot of times we're working against a misconception or misinformation that the patient's been given or has researched on their own. In the pre-treatment video, we had a patient who came into the office that said, my old dentist only did metal fillings. He said every 2 to 3 years, the other fillings have to be replaced, and I don't want that. And that was the first time I had encountered that. And you realize that there's a lot of ways to kind of spin what you do or show that what you do is better than maybe another method. And it's our job as providers to make sure patients have the right education for that. And with that, like I said, it makes them feel really empowered. Patients will be impressed with your clinical efficiency. It doesn't matter if your patient has dental anxiety or not. I'm sure they have somewhere that they would rather be than sitting in your dental chair. So the quicker that you can work, the more efficiently you can work to get them in and out, they're always going to be appreciative of that. So using or choosing to use materials that let you work more efficiently, that will be noticed by your patient. Patients tend to be more comfortable during this procedure because you're able to set the material faster, or you're able to let them close and take a break while the material is setting. So when I think of this, I always think of our patients that have TMJ discomfort, our bruxers, or people that have had a history of trauma. When you're placing 2 or 3 or 4 composites at a time, that's a long time for the patient to be open. In an ideal situation, you can use a mouth prop, but I think we all know not every patient can tolerate that. So if your patient's not able to use a prop and they have a muscle fatigue and they're unable to stay open, being able to cure the top layer of the material and then let them close while, say, the rest of the material in the proximal box sets, or to be able to be completely done and give them a break before you move into the adjustment phase, is something that's going to be really well received by your patient. It's not surprising that people are pleased to have less post-op sensitivity. And this was probably the most surprising thing I found when I started using Activa, which was a little over a year ago. I used to have patients that had a lot of hot and cold sensitivity after restorative. And, for some patients, it's a couple of days and it's not a big deal. And for other patients, it can be really prolonged, and it really makes them question the treatment that they've received and whether or not things were done appropriately. And it's sometimes hard to explain to them that this can be a normal part of the process, that in drilling in their tooth, you're doing, minor surgery and it might be sore. So to be able to use a material that has a good seal, that lets you keep the heat from your light away from the pulpal floor of the tooth, that is really a benefit. And people want to talk about the fact that they don't have sensitivity. So it's funny, I always kind of smile to myself when we have a new patient that comes in that says, oh, my sister, cousin, aunt, insert the relation, comes to your office and they said that you use the material that keeps my teeth healthy. Oh, did they? Well, that's exciting, because maybe they're hearing me, right? All the times that you're talking to your patients and educating them, good news travels fast. So I think what happens in a lot of situations is someone will say, oh, you had a dental visit. Sorry to hear that. And then your patient can say, actually, it was great. I was in and out quickly. Didn't have to sit there with my mouth open for a long time, and it didn't hurt afterwards. That is the best publicity that you can ask for. So this slide wasn't originally part of my lecture, but in thinking about all that's going on in the world, I think it's an important mention here. This has been a really tough year for our industry, for a lot of industries. I shouldn't say just for our industry. I'm sure your office, like mine, was closed for a period of time. We were closed for about 3 months when the COVID-19 pandemic first hit. And there's been a lot of changes as to how we practice, as to our PPE, and what we're doing to minimize exposure in our office. I think dentistry is very fortunate in that we've always practiced under universal precautions, but we've had to step that up even to the next level. So when you're using a material like this and you have the option to decrease the time it takes you to fill a tooth and then set the top layer and have the patient close their mouth, in a sense, you are limiting your exposure to any sort of fluids from the oral cavity. I'm hoping that everyone's wearing their respirators and their shields, but even being able to place the material faster versus having to do numerous increments and changing out cartridges, that is beneficial. It's less time that the patient could be coughing on you, could suddenly have an itch and need to move, or you get salivated on. There's so many things that can happen so quickly. Your assistant's trying to keep things dry. If you're not using a rubber dam, you might be getting splashed in that sense. And also being able to, like I said, set the top layer of the material and then let the patient close. It's a relief for the patient that they get a break, but it also limits the time that you and your staff might be exposed. So it's not a huge part of how this material is used, but it's definitely something to think about in the climate that we're currently working in. So if we're looking at scheduling in your office and we're looking at the efficiency of this material, if you're using a traditional composite, you're probably curing in 2mm increments, right? If you're using a universal, maybe you are able to cure in 4mm increments. How much time does that save you to be able to set a material, twice as fast, or to be able to set the top layer of a material and go into a hygiene check and come back, right? That you're not sitting there having to actively place the layers and set them. What does that look like at the end of your day, at the end of a week, at the end of a year? Think about it in the sense of doing same-day conversions in your office. You have a patient in for hygiene, they need a filling. You know you can do this quickly. It's a convenience to the patient. People are now trying to minimize their times out of their homes, and it helps you to increase your production. So if your overall production increases, we would expect your overall collection to increase, right? See some level of practice growth. Do you want to be able to see more new patients or to diagnose and treat more dental disease without having to expand your hours to add days or to work late? Well, a way to do that would be to work more efficiently. And finally, do you want more patient-based referrals? In my experience, the patient-based referrals are the best. They are the patients that are your most loyal. They are the patients who are usually most accepting of your treatment plans. And they're the patients who actually follow through with their treatment plans. They don't just say, oh, doc, that sounds great. They're actually scheduling their treatment and getting it done. Okay, so for me, those patient-based referrals are incredibly valuable. And not to say that we don't get great patients referred from their insurance companies or Google. It's just different. So let's look at cost. I feel like it's really easy to assume that a material that has all these great products or properties is probably really expensive. So I use Benco Dental Supply. They're my main supplier. And so the information on your screen was taken from Benco. So I compared Activa to Filtek Supreme Ultra, the Tetric Evo Ceram, and then the Sonic Fill. These are three materials that I've used at various points in private practice, and then I use in the different offices that I work in. So we're evaluating the quantity of the material, how it's distributed, and then the price. So Activa comes as two 8-gram syringes. We're looking at everything in grams because it's kind of an equal way to evaluate these materials. You can purchase Filtek and the Tetric in either a 4-gram tube, or it comes as 20.2-gram capsules. And then the Sonic Fill is 1/4-gram capsules. So the prices are listed. Like I said, this is as per Benco. This might vary to some degree from different supply companies. And then we've broken this down into price per gram. So this is just like doing your per unit price at the grocery store when you're buying groceries. This is a really great way to just kind of level the playing field as far as the price and not worry about the amount that you're looking at. So you can see that Activa is almost half the cost of these other materials. And this is something that it's like, you're working for half the cost. You're getting a larger dose at a time. So you're not having to change out cartridges, right? That's going to save you time. What does that look like long term? You're spending less money, you're working faster, you're seeing more patients. So you're bringing your overhead down, while in theory, you're bringing your production up. I don't know anybody that doesn't want to do that. That's a good thing, right? And now we talked about the bonding with Activa. If you're not bonding with it, that's a huge cost savings. Like I said, bond is one of the most expensive products that we use in our office. There are certainly situations that bond are indicated with other materials or that you might want to use it here, but knowing that you don't have to, if you're looking at your overhead, the cost of each procedure, that makes a really big difference. And I think that in this economy during the COVID-19 pandemic, we're all looking for ways that we can recoup some of the funds that are lost or be more efficient and save more moving forward. So this is a way to do that, a simple integration of a new material into your practice. I want to talk about the tips for a minute because one of the concerns that I had with this material was, well, we're using these fancy tips. I'm going to have to buy tips. How much material is being wasted in the tip? Am I constantly going to be throwing away a big section of material? So you can see here that there's the hub, pretty standard for the mixing tip, kind of like the mini mix or a Reliax. There's a variety of products that use tips like this, and then the cannula tip. And what you realize if you cut one of these tips open is that the internal part is really not much wider. Okay, and I'm going to show you a little video so that you can see. I tried to find information on the actual weight of the material that's lost in the tip, and I was unable to find that. So let's play this video. I did not make this video. There's some background noise in it, so I apologize for that.
I'm here to demonstrate that actually there's not a lot of material wasted within there. The cannula and the mixing tip basically is a very, very small diameter, if you think about it. And what I'm going to do is I'm going to cut one of these apart in half, just to demonstrate exactly how much material is really within here. And if you look really, really closely inside, that cannula has got most of the material is the mixing tip itself. It's just very lightly coated on the outside of it. Let me just demonstrate that on an unused cannula. Again, to just show you that you're not really losing a lot of material within the material here. It's mostly the mixing tip itself. So there's an internal lentulu type of a spiral that helps with it, and so the material mixture is very, very small.
Okay, so hopefully you guys could see that okay. I know it's a little small, but the take-home point here is that there's not a lot of material lost in the tip. The tips do come in the package with the material. So when you get your 2 syringes, it comes with a supply of tips. I have yet to be in a situation that I've had to purchase extra tips, but certainly you can buy them separately if you like. I'm going to just go back a couple slides. So I prefer this tip, although you can use others. I like the metal cannula because you can bend it at any angle that you're trying to work at. Even if you bend it at a hard 90 degrees, the material still flows out, and you don't have an issue with trying to squeeze it out like you might with like an etch or a similar material. So when you're trying to do quadrant dentistry and work a little more efficiently, you can change the tip as you go to be able to fit and reach into the areas that you're working. So I love a good pun, tips, haha, to conserve product. Doing quadrant dentistry, like we've mentioned numerous times, filling more than one tooth at a time, going through and preparing all your teeth, aligning your matrices if you're using them to do interproximal restorations, and filling all the teeth at once. In certain situations, especially if you're doing occlusals or smaller restorations, you might even be able to fill teeth in numerous quadrants at once. If I'm able to do treatment on, for example, the entire right or entire left-hand side, I try to do that. And that certainly helps to conserve not only the tips for less waste, but also conserve the material because you're not really losing as much to that tip compared to if you were changing them out numerous times throughout the procedure. Some other sort of hacks or things that you can do is, I've been in offices where they put like a black or an electrical tape around the clear part of the tip. We know that the material takes 3 minutes to set. So by blocking out the light on the clear part of the tip, it can slow the setting of the material within the tip itself. So that if you have to put it down or shift positions, you're not exposing the material to light, which is going to accelerate the setting. Sometimes I'll simply pass the syringe to my assistant. So I'll, if I have the gun in my hand, I pass it to her and she just palms or holds the tip in her hand to completely block it from the light. So that's an option as well. And that can, again, just help to reduce the set time of the material, give you a little bit more working time. When you're thinking about traditional composites and you're thinking about, is there waste generated? I would say that the answer is yes. When you're using a standard cartridge in a gun, there's probably some amount that gets wasted. Either the tip is maybe hardened because the cap wasn't put on it in your drawer, or you get to the final amount and it's just enough that you can't quite squeeze it out or get it to catch on the tooth. There's some wasted there. If you're using the tube where you're cutting off a section of composite to pack it in the tooth, maybe if you're really good at guessing or evaluating your prep, you're not wasting a lot. But in my experience, there's always some level of composite that goes to waste. So I think that this is comparable and probably less than other delivery methods. So just to review some of the things that we've talked about, hopefully you've seen very clearly how Activa BioActive exhibits the various properties associated with the remineralization class of bioactive materials, participating in the ion exchange, the apatite formation, etc. Activa BioActive is really indicated for all restorations where traditional composites can be used. It's used for class 1, 2, 3 restorations. We use it in class 5 restorations. And this has also become my core buildup material. Why not give patients a jump start or an extra boost underneath that crown restoration? On an endo-treated tooth, to have the extra fluoride and the apatite formation we want a hard seal in those teeth. Patient education is so important. Educating your patients about the materials you're using will grow your business and increase your referrals. You could be using the exact same material as the dentist next to you, but if you're telling the patient about all the properties and they're not, I would want to see the person that I think has my best interest in mind. And so just having that conversation with them, giving them that information is really going to show the patient that you care and that you're looking out for their best interest. And again, if you're the only person that's doing that, that's going to really create a buzz around your office and the procedures that you're offering. Using materials that save time and cost less per unit are going to increase your production and decrease your practice overhead. And increasing the efficiency and decreasing treatment time is going to limit the exposure of your providers, your support staff to bacteria in the oral cavity. So hopefully you guys felt like you learned a lot. I wanted to see if there were any questions. I think there's been some popping up in the Q&A box, so I'm going to do my best to go through and answer these with the time that we have remaining. So let's see. So one of the questions is, in my experience with using Activa, I've had to redo class 2 slot preps with Filtech after the Activa ones have popped out. Have you experienced this as well? And is it not recommended to use with an extension on the occlusal surface to increase surface area? So I have not experienced it coming out, and I do a fair amount of slot preps as well as, conventional preps with a tail, and I haven't had that issue. So, maybe it could be your bonding agent if you're bonding, or perhaps try using it without a bonding agent and see if you get a better adhesion. Another question is, do I total etch or selective etch? And do I put a base if the cavity is deep? So yes to all of the above. So depending on the situation, I will total etch. If I'm close to the pulp, I'll probably selective etch instead. And then as far as a base, absolutely. So depending on how deep the prep is, I use a couple different things. I really like Limelight, which is another pulp dent product. I just like the way it, the Limelight Enhanced, the way it adheses to the dentin, but also the Activa base liner is really great because again, it's dual cure. So if I'm working really close to the pulp, I don't want to have to shine my light anywhere near it in the hopes of decreasing the sensitivity and keeping the nerve alive. So there's a couple different options. Let's see. So, and yes, we had touched on this. Someone asked if I have material without fluoride, if patients refuse fluoride, and do I inform all of my patients about fluoride? I do, because in my opinion, using a material that's fluoridated as a filling material is no different than using a fluoride varnish on a patient's tooth. And I think patients have the right, although I believe in fluoride, to refuse that treatment. So other composites that we have in my office are, we have Filtech Supreme Ultra, we use Omnichroma, there's a couple of different others that we offer. We use the Mosaic by Ultradent, just kind of depends on the situation. So I think it's good to have a variety of materials in your practice. Is there a bioactive material that does not contain fluoride? I do not know. There are other bioactive materials on the market, and I think you just have to do a little bit of research on that. And then another question, would I recommend using a flowable with this material or any other liners? Again, I think if you have a deep cavity prep, using a base or a liner is a good idea. But I do not use flowable with this because the material is incredibly flowable itself. I actually think it flows better than like the Filtech flowable or some of the competing flowable composites. Okay, that looks like that's all the questions. I wanted to thank everyone for tuning in tonight, and I wanted to again thank PulpDent for their support of this lecture. It's been really great working with them as a company, but I also just really enjoy their materials. So my email is up on the screen. Please feel free to reach out to me either through email or on social media. I'd be happy to connect with you and answer any questions you might have. So thank you, everyone, and I hope you have a great evening.